All right, so in this chapter, what we're going to do is we're going to look at, when you're a baby, what you should eat, when you're a toddler, when you're an adult, and when you become an older adult, what what dietary considerations do we need to keep in mind? So the first slide, it kind of talks about that nutrition is really important as we age. So throughout our life cycle, good nutrition is important. We need good nutrition to thrive. So let's start with when a mother is pregnant. Now, if a mother is obese, there is a chance of a life-threatening disease. So they could get high blood pressure. The mother could get high blood pressure, could get diabetes. I had this condition. I'm not obese, or at least I don't think I am, but I had preeclampsia when I had my first child. And preeclampsia is like really, really high blood pressure that the child could be in danger and the mother could be in danger. All of these conditions can happen more so when one is obese. And then if you're not obese but you're underweight, that also has its own dangers. It could cause like iron issues, like anemia, so low iron. And sometimes being underweight means that your baby comes out really early. My firstborn, I had a preeclampsia, so high blood pressure, and which resulted in my child being a low birth weight baby because he was, I think, 3 pounds. He was 3 pounds when he was born. So that's a story for another time, but it can happen. So there are some myths that are out there. There are some fallacies where one myth is like pregnant women need to eat for two, right? I remember when I was pregnant, I have 3 kids. I was always told by people, keep eating more, you're eating for two, you're eating for two. But in reality, I don't need to eat for two. I just need an extra 300 calories. And that's only like once you hit the 4th month of pregnancy. So from 4th month pregnancy onwards, that's when you need that extra 300 calories. And those 300 calories that we need to eat when pregnant, they should be healthy calories. So you could have protein because that helps with the tissues, the tissues that the baby has, the fetus has. We could eat more calcium because calcium is great for the bone for the babies, right? So only 300 calories. We're not eating double the amount. And then this was interesting to me. I didn't know this, but there is a myth that's out there that says a mother loses a tooth for each child. And so when I was reading about it, what it said was that what happens is, this is the myth, okay? The myth is saying that the baby is sucking all the calcium from the mother's teeth. And that is not true. If the baby doesn't have enough calcium, then they're sucking the calcium from the mother's bones, not the teeth. I haven't heard of that one, actually. I don't know if you guys have. All right, so I dreaded taking prenatal vitamins. I struggle with swallowing pills, and prenatal vitamins, I don't know, if you look at them, they're huge. This was my daily struggle. So prenatal vitamins are extremely important, so especially if you have an inadequate diet, and it really gives the fetus all the nutrients that they need. I was taking this. I was also taking folic acid, because I don't think my diet was really good. I wasn't really eating foods that are rich in folate, and I'll show you a picture later on about some examples. Actually, I might have it here. Yeah. So these are examples that, of food that are rich in folic acid. So these are healthy foods that we should eat. I remember I was taking folic acid. Okay. So we talked about this, that, if any teeth are lost during pregnancy, it has nothing to do with the baby making you lose your child. It could be because you have a really big cavity, and that pain is really painful, and I don't know, maybe it can't be treated, and so they have to extract it. I know there is a link between periodontal disease and pregnancy, where you get gum disease, but not tooth loss, unless your gum disease is really, really bad. Okay, cravings. So here we see a pregnant mother craving pickles. So pregnancy, it does change your sense of taste, your sense of smell. This was huge for me. I couldn't stand my husband's perfume. And there are some food aversions that people can have where you can't eat one thing. Like my favorite food could have been, I don't know, I'm giving an example. I can't think of what aversion I had. But like if you always enjoy, I don't know, cheesecake, for example, and then when you're pregnant, you don't enjoy cheesecake at all. Like it's an aversion to you. You could have cravings, and you could be even craving things that you never even liked before, like pickles. Like, I don't know, maybe I never liked pickles, and now all of a sudden that I'm pregnant, I love pickles. So there could be some cravings, and a lot of us, so 75 to 90% of people, of women, pregnant women, have that. And then 50 to 85% of us that are pregnant have an aversion. There's also this condition, it's called, I'm going to type it up over here just so you know what it's called. It's called PICA. Okay, and PICA is basically a condition where a person will crave non-nutritional foods or substances. So like ashes, dirt, laundry detergent, clay, Play-Doh, and they would crave that and they would eat that. And that's actually your body telling you that you're lacking iron or some other minerals. And to compensate that, you're eating non-nutrition substances like ashes, dirt, laundry detergent, clay, etc., etc. So PICA is a term for that. All right, so what should a pregnant mother eat? Lots of folate-rich foods. Examples are here. Because if you don't, what can happen is your child can have neural tube defects. That's like, the brain doesn't develop properly, the spinal cord doesn't develop properly, and it could really, mentally and physically affect that child. So eat lots of food that are really high in calcium, phosphorus, so like milk, dairy, vitamin D. Those are all really, really good, especially for health teeth formation. And then pregnant women are always warned to watch what they're eating, because if they eat like raw eggs or raw meat or like soft cheeses, there could be some foodborne illnesses there, so they could get really, really sick, which could be dangerous for not only the mother but also the fetus. So eat food that are properly cooked. Now, when you have an infant, their weight triples by the first birthday. So they're like every month they're gaining a lot of weight, and so tremendous growth happens, right? And from from when they were born till age 1 or 2, and so we learned that the small intestine, it absorbs food. It absorbs all the nutrients. When you're eating, the food goes down your digestive tract, it goes to your small intestine, and your small intestine's role is to absorb all the nutrients. But with someone that's a baby, with an infant, it doesn't necessarily absorb all the nutrients. And so that's why we have to be, and the kidney is also not there yet. It's not fully functional. So we can't give them anything to eat. We can only give them breast milk or formula. And you should give it to them. Here it says up to 4 to 6 months. I gave it to my kids for like a year. And then after a year, I switched to cow's milk. And that's what pediatricians recommend, that after 1 year, you can switch to cow's milk. Because if you give them cow's milk early on, when they're under the age of 1, first of all, it's really high in protein, and that's not good for the kidneys. It also doesn't have like the iron. The nutrients are not there. The nutrients are all in the breast milk and infant formula. So we should only give them breast milk and infant formula for the first year. Now, there are kids that are always at the very bottom of the growth chart. So I remember my son, who was 3 pounds, right, when he was born. Every time I would go to the doctors in the first year, you go see the doctor regularly, and every time I would go for that visit, he would always be in the lower range because he was a premature baby. And so sometimes when you have individuals that are in the lower range, it can mean that they could be physically, mentally, or socially underdeveloped. So they could go through and have these issues, especially if they're at the lower range, in the bottom range. Now, what causes this? What causes them to be at the very bottom of the chart? It could be emotional issues. If a mother does not hug and kiss and say, "I love you" to the child, it does affect the child's ability to thrive and grow. So emotionally, we need to be, we need to show love and fondness and affection to our children. There could be medical issues, right? They could be like chromosome abnormalities, like Down syndrome. Or they could have like heart issues, lung issues, thyroid issues. Like so many different types of medical issues that are out there that could hinder the child's growth. Nutritional issues, so they're not eating properly. They have reflux. the nutrition isn't being absorbed properly. All this can result in the child not being able to grow. And then social issues. So we really need to educate our parents, the parents rather, about like what they should feed their children, good eating habits, because sometimes if they don't feed the children the right foods, it can impact them negatively. So here we have a picture of a toddler, and the nice thing is when you become a toddler, the soft diet food kind of goes away, because now they have teeth and they can eat hard food. They can eat solid foods. I have a toddler, and let me tell you, he is probably the most pickiest eater that I know. He eats everything bland. Like pasta will be plain, rice will be plain. He won't have any meat or anything with it. So I'm struggling here with him. But I give him vitamins to supplement, but that's not enough. I have to work on, making him eat better and healthier. Now, when you become a toddler, compared to when you were an infant, compared to babies, their appetite does decrease a little bit because they're not growing as much, right? When you're an infant to a 1-year-old, you're growing like crazy. So you're eating on demand, you're feeding on demand. But with a toddler, not so much. This is a huge mistake that parents make, where we force our children to eat even though they're not hungry, and that is not good, because if we force children to eat when they're not hungry, it can lead to obesity. So we really need to watch when we do that. And snacking, snacking is important as long as we give them healthy nutrients. So there's situations in the developing countries, children can be malnourished, and they lack protein. So protein, energy, malnutrition. So two conditions that can happen. So one of them is called marasmus, and the other one, let me see if I can spell this right, or pronounce this right, is called, I'm going to need some help here, but I think it is called kwashiorkor. Yeah, kwashiorkor. And so the difference here is, well, actually both of them, they have protruded belly, okay, as we see here. Actually, I have another slide here. So on this one, the kwashiorkor, they do have a protruded belly, and then their face is also like swollen, like bulging eyes, and they have like swollen moon face. But if you look at the marasmus, the ribs are showing, right? Yes, they have a protruded belly, but they look a lot older. Their skin are also wrinkled. So these are all malnourished kids, and it's because of the protein. They don't have enough protein, and this is what's happening, unfortunately. Okay, moving on to school-age children. So we looked at infancy, we looked at toddler, and now we're looking at children that are school-age. Now, when you have children that are school-age, what's important to know is that their liver is small. Okay, so the brain is the same size as an adult, but the liver isn't fully developed. It's only half as big as an adult, which means that one of the things we know about liver is glucose is stored there, right? Glucose is stored there, and you need glucose in order to function, in order to study, in order to be okay at school. And so because the liver is really small, it's half the size of an adult, they need to be fed every 4 hours. They need to be fed every 4 hours for glucose to be put in, stored in the liver so that they can concentrate at school. I remember a nutritionist or a dietitian once said to me that the food that you eat, 80% of the food should be healthy, 20% you can have food for the mind, or food that makes you happy, or junk food, I guess, but 80% of your meals should be healthy. Teenagers. Now, teenagers have the worst diets of any age group, and you can see that picture here, right? Instead of eating healthy, he's eating the junk food. I remember as a teenager, I was also not really, not eating good, nutritious food. So this could be because of peer pressure. Maybe they see other people, eating bad, or maybe it could even be that they see other people not eating because they have that desire to stay slim, for example, or to bulk up if they're a guy, and then they would copy whatever their friends are eating to, stay slim or to bulk up. So teenagers, they are growing rapidly, okay? So this is the time where they have rapid physical growth, like their height just really goes up. You get taller, hormonal changes that they're going through. So nutrient when we're thinking about nutrients, make sure we eat healthy food. Make sure teenagers eat healthy food. And so what they've noticed is that teenagers are consuming a lot more soda than they are milk. So that's something to be mindful for. We want to educate them on drinking water, or if they need milk, then avoid soda, but drink milk or water. Now, when you're looking at women, in terms of their height, at the age of 13, they stop growing. Their height typically stops growing at the age of 13. So sometimes now they're like, oh my gosh, I'm getting fat, and they might worry that I'm not thin enough, that you're not thin enough, right? So these are concerns that women have, and sometimes they don't eat because of the peer pressure, or because of like the pressure to stay thin. Women need a lot of iron, and that is because of their period. Every month they lose blood, and so we need iron to compensate for that. And women actually stores a lot of calcium. And so the reason for storing calcium is that later on in life, osteoporosis can happen where the bones can get weak. So if we eat a lot of calcium, that's really good because the body will store it so that we don't get osteoporosis. We're not at risk for osteoporosis when you have brittle bones later in life. When we look at men, their height, it peaks at the age of 15. So after 15, they say they stop growing in terms of height. And interestingly enough, instead of like 2,000 calories for women, men need 4,000 calories to maintain their weight. And so we want to make sure they have all their major nutrients. Really healthy food, nutritious food is important. And men have this desire. You know how women have that desire to stay thin? Well, men have that desire to build muscles. So the nutrients that they take, if they want to build muscles, it should be healthy nutrients. When we say young adulthood, this is like 30 to 50, okay? And so now what's happening is when you're in your 30s, 40s, or 50s, your metabolism decreases. And so sometimes, even though we're eating less, we're still gaining weight. Sometimes what happens is our taste can diminish. So what happens is we kind of put more seasoning to accommodate for our taste. Interestingly enough, sometimes the sense of thirst goes away as we age, and so we're not able to tell if we're dehydrated or not. Our organs also decline, and actually the textbook says it starts to decline at 30 and then progressively over the years. And another thing the textbook said is that if you have diabetes, usually it's diagnosed at around the late 40s, and if you have hypertension, so high blood pressure, usually it's diagnosed around the age of 30 to 50. So all this is happening during the young adulthood time. And so digestive concerns can happen when we're an adult. So there's something called GERD, which is gastroesophageal reflux disease. This is where you get heartburn, where you get like all the food, the acid food kind of goes back up, like the sphincter kind of opens up. The sphincter is the one that closes the esophagus and the stomach. It opens up and it kind of just brings all the foods back up. And so people who are smokers, people who are obese, pregnant, diabetic, they're at risk for GERD. And if you eat alcohol, chocolate, unhealthy foods, garlic, onions, mint, tomatoes, or anything spicy, this can really happen. So to avoid this, let's say if you have GERD, if you're a smoker, quit smoking. Try to exercise, sit up straight, they say instead of eating big meals, eat small meals throughout the day. And then if we're sleeping, prop up your head with pillows so that you're less likely to get that burning sensation. Another digestive concern is lactose intolerance, when you can't have dairy products, when you're not able to break apart the dairy products. And so there are probiotics that you can take to improve your gut health, but you would have to avoid dairy products. So now there's so many food items that are lactose free that one can take. Okay, and then when you're a senior, what can happen is your biological age may be different than your chronological age. So if I'm a 60-year-old woman, but I feel like I'm 80, then that's what they mean. Like, it's not uncommon for a person who has reached the age of 80 to have a biologic age of 60. So it could be that, let's say you're 80 years old, but you look like you're 60. Or it could be the opposite. You're 60 years old, but you look as if you're 80. And so all that depends on genetics, on life experiences. Can your body resist disease? It does, genetics typically play a huge role. Now, when you get older, the calorie intake should decrease. So instead of eating a lot, we should eat a little less. And your activity rate should increase, which means you should be more active. But typically, we're less active when we get older. But it shouldn't be that way. We have more fat, so adipose tissues, we have more fat in our body. Sometimes we're taking a lot of medications, and sometimes we lose our teeth, which makes chewing very difficult, which makes it difficult for us to eat healthy foods, because when we eat healthy foods, some of the foods should be nice and crunchy, should like fruits and stuff, right? And that is hard when we don't have teeth. So things to keep in mind when, if we're elderly, or if you know someone that is a senior, and you notice that they're eating poorly, think about why. It could be because they have difficulty swallowing. What happens is they might be taking lots of medications. Medications can cause xerostomia, as we know, and when you have a dry mouth, you don't enjoy food as much, and it's harder for it to swallow. And sometimes you might be on a soft food diet because you can't, you have dry mouth, you don't have enough teeth. And so it's hard for you to chew, it's hard for you to swallow. So all that could be why the senior has poor eating habits. Fixed income. So seniors who are, they're poverty, they don't have enough money. They're at a poverty level that is, they're struggling with making healthy meals because they don't have money. If they are depressed, what can happen is they can decrease their appetite, so they're not eating as well. And sometimes what happens is they may be eating out a lot. And if they're eating out for socialization, for example, they might be eating out at fast food restaurants and not getting the nutrients that they need. Sometimes there are restaurants that offer seniors discounts, and then they go to those restaurants. And those restaurants, again, may not be as nutritious as if they were to cook for themselves at home. All right. Thanks for listening.